Courtney Graff, and I'm a student nurse at Cedar Crest College. For my evidence-based practice research, I studied the effects of oral hygiene practices to decrease the risk of obtaining ventilator-associated pneumonia, or VAP for short. I chose this topic because there is a high incidence of mechanically ventilated patients obtaining VAP. So the clinical question that I asked was, in critically ill patients, does daily oral hygiene practices as compared to usual care decrease the risk of obtaining ventilator-associated pneumonia? To help explain the research that I conducted, I'm going to refer to the poster that you see next to me. For my research, I found that ventilator-associated pneumonia is one of the most common infections in mechanically ventilated patients. It occurs in approximately 9 to 28% of these patients, with a mortality rate ranging from 24 to 50%. VAP is also directly linked to high healthcare costs, increased morbidity and mortality rates, and longer hospital stays. These statistics are significant and impact the nursing profession. This is because VAP is directly linked with the colonization of respiratory pathogens in the oral cavity that are aspirated and as a result in the patient obtaining pneumonia. Oral hygiene practices are nursing interventions that could be implemented by critical care nurses in orally intubated patients in order to prevent VAP. Therefore, nurses must adopt evidence-based practices in the care of orally intubated patients to decrease this risk. For my literature search, the databases that I used were PubMed, which yielded 254 initial results, which was narrowed down to 30, and PubMed Central, which yielded 172 initial results, which was narrowed down to 36. The keywords that I searched were critical care, oral hygiene, preventing ventilator-associated pneumonia, and intubated patients. Limitations for my search were those articles that were published in English from 2006 to 2014, and were free full-text articles and peer-reviewed journals. The three studies that I used for my research were by Berry, Davidson, Masters, and Rolls in 2007, Fider, Mitchell, and Bridges in 2010, and Murrow, Grapp, Jones, McLish, and Sessler in 2009. The study conducted by Berry et al. In 2007 was a systematic literature review that worked to appraise peer-reviewed literature to determine the best evidence for providing oral care to intensive care patients receiving mechanical ventilation. The results of the study concluded that due to the small number of randomized controlled trials and the variations of methods used within each, a meta-analysis could not be synthesized, limiting the development of evidence-based guidelines. However, it did find that the use of chlorhexidine solutions is the recommended practice and that there is no significant evidence to support the use of sodium bicarbonate and hydrogen peroxide practices. The next study by Fider et al. In 2010 was a descriptive cross-sectional study, and the purpose of this study was to describe oral care practices performed by nurses for orally intubated patients and to compare them to the current recommendations. The study found that most respondents in the study did not know their institution's rates for patients who obtained ventilator-associated pneumonia. However, the nurses rated oral care as a high priority, with the most common frequency of oral assessments being performed every 4 hours. It also found that chlorhexidine solution and toothbrushing were among the most commonly used practices. The third study, conducted by Monroe et al. In 2009, was a randomized controlled trial with a 2x2 factorial design. The purpose of this study was to examine the effects of mechanical, pharmacological, and a combination of oral care practices on the development of VAP. The results of the study showed that the interaction of toothbrushing and chlorhexidine were not significant when providing oral hygiene. However, the study did find that the group of patients that received chlorhexidine alone had significantly fewer patients develop pneumonia, while toothbrushing was not associated with lower VAP rates. Therefore, chlorhexidine oral swabbing was effective in reducing early VAP. Since there are no evidence-based guidelines to support oral hygiene practices in these patients, recommendations have been made. Efforts to prevent complications in mechanically ventilated patients needs to be started at the time of intubation. There also needs to be more well-designed randomized controlled trials in order to establish evidence-based practice regarding this topic. Berry et al. Also recommended looking at the nurse's perception on the importance of oral care hygiene in these patients in order to increase efforts among nurses to provide proper oral hygiene in critically intubated patients. Further research also needs to be done to establish the best frequency and duration of oral hygiene practices, along with an evidence-based standard for oral cavity assessments to reduce the risk of obtaining VAP. In conclusion, oral hygiene practices can be used by nurses to decrease the risk of VAP. Current recommendations for oral care practices in critically ill patients receiving mechanical ventilation is the use of chlorhexidine solutions. However, there are no evidence-based guidelines established regarding best hygiene practice in this patient population, and further research needs to be conducted regarding this topic. That concludes my presentation. I hope you enjoyed it.